Welcome back to Real Health. It's good to have you with us. Now, testosterone replacement therapy in men has been a common practice for a number of years, but testosterone replacement therapy in women is something that is very new. Here to talk to us today about it is Dr. Mark Opperman from the T Clinic. Mark, welcome and thank you for joining us.
Michael, thank you. It's good to be back.
Thank you. Now, Mark, testosterone replacement therapy in men, what is the main reason why this is something that is done?
You know, like we've discussed in previous episodes, for me, the biggest function of testosterone in our later life is on higher function. It works on the brain, it works on mood, it works on stabilizing and increasing muscle mass and bone density. You know, and this is after we had the sexual development phases. So the biggest effect of testosterone on higher function in the brain.
Okay, so I mean, it's a very important hormone in the body, and it's from youth to the end of life.
It plays an essential role in sexual development in both men and women.
Right.
You know, and then it's one of those stabilizing hormones. People always think of testosterone as the one that makes you aggressive. It's not, it's estrogen.
Okay. And also, it's generally testosterone is accepted as being a men's hormone. We don't often speak about the role of testosterone with ladies.
Absolutely. You know, it's very interesting when people come into my office and we speak about testosterone, and that testosterone converts into estrogen in men. The majority of the patients in my practice have adequate amounts of testosterone, but high levels of estrogen.
Okay.
So it's a balanced fat cell.
Right, okay. Now, in terms of replacement therapy of testosterone in women, it is very new. You were saying a little bit earlier that it's sort of a just released paper. Why is it such a new study compared to men?
So there's been a lot of studies that has been done on the benefits of testosterone in women. But recently they did a cohort paper on it. So they took all the information that they could gather of all the studies, and they wrote a paper, and the paper was done by the American Sexual Health Society, or something like that, if I remember correctly. And what it has shown is that in post-menopausal women with hypersexuality syndrome, or, you know, in layman's terms, a low libido or a low sex drive, but injectable testosterone is the preferred method of treatment. Okay. Now, this opens the door for our older women to, you know, feel as young as they want to be from a sexual perspective. I think this is the next sexual revolution.
I think it's such a big thing for ladies in terms of, well, for ladies and men, in terms of aging, that sense of you're no longer able to enjoy sex because your time is up. You know, you've done what you need to do, you've had your kids, and that's the end of it. But from what I've read, a lot of people are not ready to give up. So it's a bit of hope for the future.
You know what? I think there's a lot of hope for the future. If we take that suddenly, when you're in your older years, you have time to enjoy this with your partner.
Absolutely, yeah.
You know, when you're working and there's children in the house, the chances of having quiet alone time is difficult. So we touched on the O shot and the ED shot and PRP treatments in sexual dysfunction in the previous couple of episodes that we've done. For me, the combination of restoring function and improving function, lubrication, sensitivity with something like the O shot, and then actually being able to enjoy your more youthful organs.
Yes.
And actually wanting, and this is the big thing, it works on the wanting part, the higher function part.
Right.
You know, it opens sexual doors to so many people, and this is an easy treatment to do in the sense of it's just an injection that someone administers. So for the patients, very easy.
Yes.
It's a little bit more difficult when it comes to the work that I do. But it changes lives, and it will change lives.
Let's just go back. You said we have discussed the P shot and the O shot, which is plasma therapy. What is the distinction? Let's just clarify that between what that does and what testosterone does. You mentioned function versus desire. How do we just unpack that a little bit more?
Okay, so if we look at PRP or platelet-rich plasma, what we after in treatments with this is the growth factors. So platelets release growth factors to heal wounds or help to heal wounds. So when we harvest the platelets and we inject that into compromised tissue, compromised either in blood flow or in nerve endings, you restore that tissue to a more youthful state.
Okay.
So that is PRP.
Right.
And that will restore function. Your testosterone, as I said earlier, the biggest effect of testosterone is on higher function. So, that's where sexual thoughts and fantasies come from, is from the brain.
Okay.
Some people feel sexually dead. I can't care, I don't want it. Doing PRP in the penis or in the vagina, it's not going to change the way that you view sex. It might make it more interesting or more sensitive, but it's not going to make it more spontaneous.
Okay.
Where testosterone therapy would work on the spontaneity, the want, the need to have.
Right. Now, what about the other factors that are at play with testosterone in the body for ladies if they are undergoing some sort of replacement therapy? Are there other benefits to the body?
Well, when we think about hormone replacement therapy in ladies or women, we're thinking of estrogen and progesterone. This will continue. There's no change with that. The testosterone treatment will have very little effect on the estrogen metabolism, unlike in men, when it has the opposite effect.
Okay.
So for women that are thinking or contemplating starting hormone replacement therapy, or who are already on hormone replacement therapy, this would not impact you.
Okay.
There's no contraindication to that.
Okay. And from a physical side of things, I know testosterone in men is associated with sort of bodybuilding and strength training. Is there sort of a positive side effect potentially with ladies in terms of strength and muscle? I'm not talking about building muscle, but just muscle tone potentially and helping with that?
I will be careful in answering this. Yes, it will.
Okay.
It can. One of the most difficult things is to keep the testosterone levels within physiologically correct and accurate levels. The moment that you go beyond that, you're going to create complications.
Okay.
But that's exactly the same as with any other medication.
Yes, absolutely.
With testosterone supplementation in men, we have a very wide range that we can play with. In women, that range is it's 2/3 smaller.
Okay.
So, you have to know what you're doing.
Yes.
It does impact other systems if it doesn't impact the hormone system itself.
Okay, so I think that's a very important factor to say that if you're going to explore the possibility of hormone replacement therapy as a lady, especially testosterone, you need to be dealing with a reputable practitioner who's qualified to be administering this kind of thing.
Absolutely.
Okay.
Absolutely. This is new. It's going to take a while for the medical fraternity to buy into it. It's been known for many years that testosterone improves libido, but doing it safely is the difficult part. For men with testosterone, it's easy. The preparations in testosterone have been formulated for men. There is no formulation for women. So you have to use something that will have the effect of testosterone, but you need to be able to titrate the dose.
Okay.
That's where it becomes a little bit tricky.
Right. Mark, now are there people ladies particularly, who might explore this kind of treatment who should be very cautious or possibly avoid it? Are there risk factors involved for certain people?
You know, as with any medication, there is certain risk factors. I think the main one here is to stay away from is if there's cancer. You know,
Okay.
if we are breast cancer survivor or we have active breast cancer, you know, those are things that, you know, what we will look at very carefully.
Okay, okay. And Mark, you have the T clinic. Are you administering this at this stage? Is
Yeah.
it something that you guys do?
So I've started a couple of patients to develop a protocol for this.
Right, yes.
The feedback that I'm getting from them is phenomenal.
Okay.
But really, I was surprised at how big the effect of testosterone was on men. I'm astounded on how big the effect is on women,
Okay, very
if done
interesting.
correctly.
Yes, yeah.
Fabulous.
And Mark, how can people get hold of you if they would like to explore this?
Okay, so we have a couple of clinics. We have one in Johannesburg, there's one in Umhlanga,
Okay.
and then we have one in Pretoria, and I have one in Malawi.
Okay.
So I think the easiest is to get hold of us at the clinic in Johannesburg.
Right.
The number there is 01178 41168. You can go to the website,
Okay.
thetclinic.com,
Perfect.
and you know that you will find all the information that you need there.
Wonderful. Thank you so much, Mark. I think it's great to be exploring new opportunities and wonderful to be on the cutting edge, I'm sure, from your perspective as
You
well.
know what? It's great to sit where I'm sitting at the moment. This is
Wonderful.
exciting times.